Good morning, gentlemen. As you all know, my name is Ahmed Ibrahim. I'm a deck officer student in the second year. And what I'd like to present to you today is about fractures. So I've divided my presentation into 4 parts. The first part will be what is fracture. And then we'll move on to the second part, which is symptoms of fracture. And then the third part, types of fracture. And the last part will be first aid for fracture. So let's start with the first. Part of the presentation, which is what is fracture. Fracture actually is the medical term of a broken bone, right? So fractures are very common. An average person has two during a lifetime, right? It happens when the physical force exerted on the bone is stronger than the bone itself, right? Your risk of having a fracture, it depends on your age. In childhood, fractures are very common, although it's less complicated than fractures in adults. Alright? So, and also as you age, your bones become more brittle, so you're more likely to suffer fractures from falls that would not occur when you were young. Cool? That's it about the first part, so let's move to the second part, which is symptoms of fractures. The first symptom, which is severe pain. When you get a fracture in your hand, for example, you feel so much pain, and that's because the bone is broken, and when you try to move your hand, you feel so much pain because there is no bones, you cannot move your hand easily. Alright. The second symptom, which is difficulty in movement. If you break your hand from here, for example, if you break your hand and the doctor comes to diagnose your hand and ask you to try to move it, alright, you will have a difficulty in moving your hand because there is no bones, it's broken, so it hurts so much to move it. That's the difficulty of movement. The third symptom, which is swelling. You all know what swelling is? Right. Swelling is that, for example, when someone hits you with a stick in your hand hardly, you will see that your hand becomes red and it's starting, like the skin becomes bigger. That's swelling. Alright, bruising is that, I'm sure any of you here has a bruise in his leg or something. Bruising is that, for example, when you play football and you get a strong hit in your leg, you see that there is like a sign in your leg that the skin becomes green and purple. That's the bruising. Alright, bleeding, that's in case of an open fracture, and we will know what's an open fracture in my next part of my presentation. Cool. Deformity. Deformity means an abnormal twist of the limb. For example, if the fracture is on the finger, you see like your finger is like that, but if it's broken, it might be like that. See, that's an abnormal twist of the finger, right? So, and the last symptom of the fracture, which is tenderness and applying pressure. If your finger is like, if the fracture is here in your hand, and you come to apply pressure with your hand, you will see that the skin is going down easily because there is no bones, you're already broken, so it will be going down easily. That's the tenderness and applying pressure. Cool? That's it about the symptoms of fractures, so let's move to this next part, which is type of fractures. Alright? First of all, let me show you the pictures. Alright. The first type of fractures will be... Oh, sorry, let me connect that. Alright, as you see, the first type of fracture is an open fracture. As you see here, the bone is broken and it's not aligned anymore together. And we call it an open fracture when, like when the person, after he gets this accident, when he tries to move a lot, this skin might move a lot, so it breaks the skin, causing an open wound. Alright, that's an open fracture. Alright, so the second type of fracture which is closed fracture. As you see here, it's broken, but the person, because he didn't try to move, so he stayed in the accident scene, he didn't try to move a lot, so it's still not aligned together, the two bones, but it's broken, but because it didn't move, it didn't cause an open wound. It's still inside the body. Alright, that's a closed fracture. The third type, which is complicated fracture. Alright, the complicated fracture usually happens in the rib cage. Right? You know what is a rib cage? This is the rib cage. It's so complicated because, like it affects the adjacent organs. like the spleen, the kidneys, your lungs, and it might affect also the heart. Alright? That's why they call it a complicated fracture. The fourth type of fracture is the stress fracture. You see here, stress fracture actually it's an incomplete fracture, alright? It happens, like when you apply stress on your bone. For example, when you go to the gym and you start practicing a lot, and you're already tired, but you're still trying to practice a lot, more than you can. So suddenly your bone might just get cracked. As you see here, it's just cracked, but the bones are still aligned together. It just cracked because you apply so much pressure on it. Cool. Right. The last type of fracture, which is green stick fracture, that usually happens in children's because their bones are more flexible. This also is an incomplete fracture. It's just when the bones get bent. You know what is bent? That is bent. Right? It's incomplete fracture. Just the bones it gets bent, and that usually happens to the children when they fall or something. Cool. That's it about the third part of my presentation, which is type of fractures. Let's move to the last part, which is, alright, let me just go back. Alright, the last part of my presentation, which is first aid for fractures. Alright, for example, for the open fracture, you actually need a serious help. So the captain should be informed in order to call for immediate assistance. Until the help arrives, don't you ever apply a pressure on the wound itself, right? That might cause a further damage by moving this bone inside the person's body, and that will cause more damage to the person himself, right? So you just grab any item of clothes and you apply pressure near the wound, near the fracture, but not on it, to see if there is a point where you can slow the bleeding until the helps arrive. Cool? Right. Regarding a closed fracture, right. Closed fracture is also one of the dangerous fractures and also needs immediate assistance. So in any type of the fractures, the captain should be informed in order to call for immediate assistance. Until the help arrives, you just need to stabilize the injured area by using a splint if necessary. Do you know what a splint is?
No.
Alright, splint is like, let's say that the fracture is here in your hand, and you're on board the ship, you don't have, like gypsy or anything, so you just grab like a piece of wood, right? You put it here to keep this injured area stabilized, alright? Cool. Also, you can, what should be done also is you grab a pack of ice, alright? Put it in any item of clothes, and put it in the injured area to avoid bruising or swelling. You know what bruising and swelling is, right? We're going to talk about that. Cool. That's it about the closed fracture. Regarding the complicated fracture, that's actually the most dangerous type of fractures. In this situation, like you don't have much to do. Alright? You have only two things to do in such a situation, because but before I tell you what you should do, I care also to tell you first what you should not do. If something like this happens in a complicated fracture, the person should never be moved from his place, because that might make the situation worse. Like when you move the person, and like if his rib cage is broken or something, when you move the person, the broken wounds might move inside his body, and it might affect like a sensitive organ, like the heart or the lungs or anything. So he will definitely die. So you never move the person from the accident scene. Right? But what you can do is, you check for other injuries, like around the body. Of course, when he has such a complicated fracture, of course he has other injuries in his body. So you check these injuries in his body, you try to deal with it, so it doesn't make the treatment complicated later. Alright? The second thing which is important is that you stay with the victim, you stay with the person he's suffering from these fractures. Right, because don't let him get into a shock, because when the person have fractures in his body, he knows that he's going to die, because it's so it's so likely that he's going to die. So you have to stay with him and don't let him get into a shock. You see, I'm sure you've seen before in the movies when like when someone is dying, they stay with them, they tell them, stay with me, stay breathing, These things actually help, that you wouldn't give up for life easily, alright? That's it for complicated fracture. So the fourth, regarding the fourth and fifth type of fractures, stress and green stick fractures, that's, like the first aid for stress fracture and green stick fracture, that's actually, like more easy than the other types, alright? You can easily just help the person. For example, first of all, you need to ask the person to support the injured area with his hand. Like if you have the fracture in your hand, you just tell the person to support the fracture with his hand, alright, and just keep it on his leg. And you also grab any item. Aslan, can I borrow your jacket? Of course. Thank you. So you ask the person actually to support the fracture with his hand, and then you grab any item of clothes and you put it in his leg, alright, to avoid any unnecessary movement until the herb arrives. That's it for the green stick and stress fracture, alright. So that's it. About my presentation. So let me just summarize what I've talked about. I've talked about what is fracture, and I said it happens when the physical force exerted on the bone is stronger than the bone itself. And I've talked about the symptoms of fractures, which is severe pain, difficulty in movement, swelling, bruising, bleeding, deformity, and tenderness when applying pressure. I've also talked about types of fracture: an open fracture, closed fracture, complicated fracture, stress fracture, and green stick fracture. And we can consider the open fracture and complicated fracture are the most dangerous types of fractures. And I've talked also about the first aid for fractures, so that when you go on board the ship, you know how to deal with such situations. Alright, so that's it, and thank you for your attention. Please, if you have any questions, I'd be glad to answer them.
Yeah. Cool.
Right. No one has any question?
In case of the fracture of the heart,
Sorry?
when the bones, when you get hit in the chest,
Yeah.
and the bones get into your heart, is it like for sure you're going to die, or it's like...
It's a shame.
Well, it actually depends. As I told you, that's actually, like when you get when you get the fracture here, alright, and it's near the heart, if you remember what I say, that's actually a complicated fracture. So if you remember what I say, is that the person should never be moved from the accident scene. Because if you move him, that broken bone might move to his heart and he will definitely die.
No, my question was like, if these bones are like step the heart, but not deep inside.
No, he will die.
Even a little bit.
Yeah, he will die because, like the bones actually of your rib cage are really strong. So if it touches the heart, right, it might break the heart itself, so he will die definitely.
Wow.
يمكن ما
We
مكتوب
don't
له من
know.
يموت.
We don't know. We're talking about first aid here. This is your job, okay? So it's not your job. You're not paramedics. You're not doctors. So we're talking about your role as an officer or a seaman. What would you do as a seaman as first aid? That's it, okay? We don't want to go into technical medical terminology or sophisticated cases. Yes?
Alright. Any more questions?
No questions.
Alright.
Everything's
Alright.
Thank you.
Thank you for listening. Thank you.
Okay, cool.